Hello, everyone, and welcome to the sixth webinar in the ALMA 2020 webinar series. My name is Thad Gurley, and I will be moderating today's discussion on laboratory directors, find balance in the pandemic. We'd like for our webinars to be interactive, so we urge you to submit your questions at any time during the webinar. Our speaker will address the questions at the conclusion of the webinar. Please use the question box on your GoToWebinar browser to submit questions. We will try to answer as many questions as possible, but if you run out of time during the question and answer session, I will forward any unanswered questions to the presenter. Additional resources for the webinar are located on the right side of your screen. The webinar is being recorded and will be posted on the ALMA website shortly following the webinar. I would especially like to thank our sponsors, American Elements and Spec CertaPrep, for sponsoring our sixth webinar. Without their sponsorship, we would be unable to provide the webinars to our ALMA community free of charge. So with that, I would like to introduce our speaker today, Joe Keary. Joe Keary is a graduate of Manhattan College with a biology BS in biology, Seton Hall University, master's degree, and New York Medical College, master's in microimmunology. And he's got an MBA in Westchester University. Currently, he is a doctoral candidate in the Doctor of Healthcare Administration program at Central Michigan University. During his extensive career, he served for 31 years as a commissioned officer in the U.S. Army Reserve. During his time, he served as microbiologist, laboratory manager, healthcare administrator, plus 3 assignments as combat support hospital executive officer in Kuwait and Kosovo, and his culminating assignment as commander of a multifunctional medical battalion. He retired from the U.S. Army Reserve in 2011 as a lieutenant colonel. In a civilian capacity, he worked as a medical technologist for private laboratories and accepted a leadership position as an operating room materials manager in both New York City and suburban New Jersey, then joined federal civil service as a healthcare administrator for the U.S. Army Reserve, laboratory manager for the Department of Veterans Affairs, and chief medical technologist for the U.S. Army. He retired from civil service in 2018 with a total of 28 years of civilian service. He has been an inspector for the College of American Pathologists for the past 22 years and is a private leadership consulting firm, JGK Leadership Consulting. He's a member of the Clinical Laboratory Management Association, where he currently is the treasurer, the Society of American Federal Medical Laboratory Sciences, the American College of Healthcare Executives, American Public Health Association, and he was recently selected as a special aide-de-camp for the governor of Kentucky Colonel. He's also plays a role with Veterans for Foreign Wars and Catholic War Veterans of the U.S. He's married with a wife, Claudia, 2 grown children, Joseph and Mariana, and 2 feline children, Georgie and Beatrice, and he resides in New York. Joe, thank you for joining us today.
Thad, thank you very much, and good morning and good afternoon to everyone. It's really a pleasure to be a part of the ALMA webinar series this year. My topic today is finding balance in the pandemic for those of us who are lab directors, and the best way I could begin this is to use a book that I really admire, Charles Dickens' Tale of Two Cities. I put the plus after 2020 because we all know that this pandemic is not going away anytime in the near future. So when I think back on Dickens, and this takes me back to my days at Manhattan in literature, I think the phrase, it was the best of times and it was the worst of times. It was the season of darkness, and it was the spring of hope. And that, to me, epitomizes what we're facing as laboratory directors and just citizens during this pandemic. The best of times, the diagnostic and research laboratories are making a tremendous positive impact on patient care. But the worst of times, we have 54 million cases worldwide and like 1.31 million deaths as of the other day. The season of darkness, we're facing fear, anger, despair, and we're now facing wave 2 of this pandemic. But the spring of hope, and that's what I want you to take away from today, is that researchers, applied scientists, and clinical laboratorians are collaborating to control the rate and understand both the biology and the immunology of this agent. So, how do we deal with it as leaders, however? The point I would like you to start and remember throughout the rest of my talk is that we need to maintain what I call a top-down focus. And I'm going to cover 5 primary areas of interest to us. The first and most important is that we need, throughout this pandemic, to stick to our principles, our good laboratory principles, adhere to them, and don't succumb to the temptation to let them slip. Second, we need to coordinate our operations to maximize their effects. Third, and again, overarching, is to support our staff and each other. Consider adopting new technologies, we see that, or developing our own. And particularly the research and industrial laboratory communities have done a tremendous job in adapting new technologies and reinventing the science. And finally, the last is remembering the other areas of our lab operations. Now, I wrote this primarily with a clinical focus at first, but it really does apply across the gamut of all types of laboratories. So maintain top-down focus. You see there the tunnel with the virion at the end. The biggest challenge I see is to avoid tunnel vision. And you can see now that everything is about the pandemic. It's tough, the severity, the impact, the concern. I mean, everyone I speak to talks about what's going on with the pandemic. As Thad said, I live in upstate New York, and we're just talking today about are we going to lose the ability to or decrease the ability to meet, or the ability to get out, and wearing masks, etc. It's overarching. It impacts us in all dimensions, but we can't forget that there are other priorities in our laboratories, in our lives. We have to keep those well aware of those, and also remember the people we work with and we live with, our families, our friends, our colleagues. And finally, remember to continue those good laboratory practices, because we don't want to succumb to the loss of quality. On my screen is freezing here. There we go. We need to remember that there are other conditions out there, other diseases, other illnesses. I'm involved with the Alzheimer's Association because my father was a victim of Alzheimer's. We need to remember that the work we do, whether it's focused on COVID-19 or not, is also important. And every patient's life is valued. Our respective areas of research and what we do daily is value added too. And we need to clearly and earnestly promote this top-down value of basic and applied research in other areas of science and medicine. Now, I know in the clinical world, the focus of all the hospital administrators is COVID, COVID, COVID. And, my colleagues say to me, but we have cancer patients, we have heart patients, we have respiratory patients, we have all these other testing we have to do. We can't devote all of our effort to one disease. So we have to take this top-down, looking down at the entire forest and not focusing on one tree. Maintain adherence to lab practices. Now, I'm sure that all of you are committed to the GLPs here, worrying about your systems, how you perform studies, reporting them, etc. As a CAP inspector for many years, that was one of the things I would always drill down on to see, is your practice, do you practice your practices and policies and procedures? So it's a natural inclination to try and create and take shortcuts. And we see that in anything we do, whether it's work-related or our personal lives. But we need to avoid the temptation to normalize deviance. And I'll explain that a little bit more in a minute. We need to stick to our good laboratory practices and our regulations, but it almost seems impossible to do so because our regulatory bodies, our governmental organizations seem to be rapidly changing too, and frankly, not always in a logical way, because they have a different perspective of this pandemic and how they must treat it. But we have to remember that doing the right thing for the right reason is always the essential element to benefit both the patients we serve and the processes we comply with. Let me talk a little bit about normalization of deviance, in case that term may or may not be as familiar with it. It was coined by Diane Vaughan, who's a sociologist at Columbia, back in 1996 when she was working on the Space Shuttle Challenger disaster. So normalization and deviance refers to when people in a profession become insensitive to deviant practices. And by deviant practices, we're looking at variation from what is acceptable. And then they fail to see those errors because it is a very small and incremental deviation from the standard. So they regard those deviations as acceptable, and we call that normalization, you know that. And this progresses into the spiral of successive variations. So it is more of an evolutionary change in our practices rather than revolutionary. And folks who are involved in normalization or subjected to normalization of deviance really don't see what they're doing is wrong. So there's a couple of examples I give you: Chernobyl, the 737 MAX, which I just received notes today that the FAA has certified that aircraft to fly again, and the Challenger incident, where there was an increase, moving away from a normal temperature range. They had a certain range at which the O-rings were certified to perform, and it would increase the temperature would decrease slightly and move away from that. And they kept saying, but it's just another degree, or it's 2 more degrees. It's not a big thing. And cumulatively, this became a large problem. So this picture shows the deviation spiral. You start at the middle, the normal, and as you down in the lower right quadrant, every deviation that doesn't result in failure resets normal to a new normal. And then that new normal is subject to another subjective deviation. And then no failure resets to a new normal. So you're in the military, we would call this widening the shot group or the acceptable target. And it just continues to reset with successive deviations and successful resets of the new normal. So very incremental. It's very difficult to see the deviations, but it reduces the potential to avoid an issue. And eventually, if the deviation spiral is left unchecked, we run the risk of a Chernobyl or a Challenger accident. This is a graph that I adopted from a senior patient safety advisor to the French National Health Authority. And if you look in that gray area, there's an abbreviation: borderline tolerated conditions of use. So you start out with your rules and protocols on the right, and then successively it goes into the illegal but normal. You know, you're increasing the amount of risk or the amount of deviation you accept. The next is the close call, which you would say only under extreme conditions, the life and death matters. And then as it continues to deviate from the norm, we wind up with incidents or accidents. So we have to be very careful in our day-to-day operations to not become susceptible to this and to not let our guard down, to let our standards down, our sense of right versus wrong deviate enough to make an incident or an accident which would be illegal, and more importantly, it might be fatal to someone. Now, we all know we have to accept some risk. Risk management or risk mitigation is important. We can't eliminate all risk, but we have to mitigate or manage it. Now, for normalization and deviance, the normal safety reporting systems, which focus on bad effects, bad outcomes, don't normally spot this drift or this shift. The tendency is more social. Is social, not individual. So you accept it as a group. This isn't one person saying, I'm going to go rogue and I'm going to let this happen. But it's that group think which says that we all sit down and say, yeah, we can do that. It's again, it's a few degrees. It's we don't need to be as specific or sensitive in the assays we're developing. We can, because we need to get this done. We feel the pressure to achieve, so we relax our guards and our standards. So to detect this migration, we need proactive systems an introspective look at what we're doing, to look in the mirror and see what we are doing and the effects of that, not relying on outside or external control systems. The best defense is social controls, looking over each other's shoulder and saying, hey, you know what, Joe? I think you're going down a path which is frankly not acceptable in our organization or on our team, and we need to rein this in. Not simply rules, because again, you can normalize away from the rule. The next one we talk about is coordinating lab efforts. Now, in our labs, all of us have areas which are disproportionately affected by COVID. I know in the clinical labs, folks are short of staff. I mean, every day I get emails saying, we're looking for people for this organization, that organization, we're offering bonuses, etc. There's decreased workload. All laboratories, research, clinical, industrial, are facing the demand to do more with less. And these imminent operational demands, we need more test kits. We need a faster assay. We need you to improve turnaround times. Pressing from our leadership onto us, we need to remain resolute and say that enough is enough. We cannot move faster and maintain the degree of safety and quality that we find necessary. There are other discretionary activities and other causations. I mean, we're being forced to combine other areas and work with other areas that may not be our natural partners. So we need to emphasize a term which one of my former bosses in the Army taught me was flexecution, flexible execution. We need to be able to shift on a very short notice and continue to affect the operations we need. So in the clinical lab and in research, maybe cross-leveling or cross-training staff. I need more folks on this project, so I'm going to provide them with the training they need to move them to that area. And there's a little bit of uncertainty usually on the staff members' part, but we've cross-leveled people from hematology to chemistry, and they have the basic understanding to begin with, but it's teaching them more the specifics of that project. Going more to shift work to optimize utilization of the equipment we have, and breaking down those silos between areas. Again, using clinical as an example, we have anatomic pathology and clinical pathology. Anatomic is autopsy services, histology, cytology, etc. Well, when those services drop because surgeries are canceled, we cross-train those individuals into specimen processors. I mean, they're aware of the requirements to properly identify specimens and ensure that all the standards were met. So we move them into the clinical sphere to accommodate massive numbers of new specimens coming in. So we can't say, well, I only do this, or this is only my organization. I don't work well and play well with others. So we have to coordinate those opportunities to get the maximum effect. Now, this is one that I'm really, really passionate about, and it is, support our staff and each other. Now, the old cliche is our people are our most valuable resource. And, any mission statement you've read or vision statement for most organizations, it paraphrases that, people are our most valuable resource. It is true. And what we have to look at first and foremost, because anything we do in any arena is only as effective as the team that actually does it. The people who put as in the Army, we say the boots on the ground or the hands on the bench, work at the bench to get that done. We need to be conscious of and monitor the physical and emotional health of those on our team. We also need to look out for each other as leaders and introspectively, again, look at ourselves and make sure that what we're doing and how we're maintaining and sustaining is going to optimize not only the work we do, but optimize our physical and emotional health. So I'm sure you feel it as well. Many teams are very, very short-staffed for the number of reasons. Some people are be honest, are afraid to come to a certain work because they're just uncertain about the virus. So we're short-staffed and we're under pressure to perform at all costs. In the Army, we used to say that we only had to sleep for 1 hour a day because we have to get the mission done. But we know that performance is degraded significantly by doing that. And if we don't work together, individuals do not achieve as much singularly as they do as a team that's stronger together. So we need to look at our staff, to look at our team, and provide and promote ways for them to discuss their issues and mitigate stress. So as Thad mentioned, I'm an officer in the Clinical Lab Management Association. We had some webinars on COVID early on, and we just put one out there. Virtually, it was a webinar without a topic, and we said, just come on and discuss what's bothering you. And it was an open session. We asked everyone to keep their mics muted, and you would come on and say, this is what I'm facing, this is how I feel. And then people would join in and say, well, this is how I think you can help accomplish that. It gave them a chance to tell everyone what was bothering them and to learn from each other to mitigate that stress. And don't forget yourself in this area. Most leaders are selfless and they worry more about the people they work with and the people they work for than themselves. And you will accept much more stress upon yourself, and use the fallacy of, well, I can handle this, or it doesn't bother me. Well, we're in a very, very tough time with COVID, and now we're entering into the holiday seasons, which are usually tough for people anyway. So this is just a word chart here of some of the words that we have to remember. We think about all this new vocabulary, the R number, 6 foot distancing, travel restrictions. We didn't have to worry about this before. But we need to celebrate our successes. As part of this support, we need to celebrate what we're doing right. I mean, the vaccines being released, information on the vaccines coming, is something that the research, industrial, and clinical communities need to be proud of. And we need to own that pride. And we need to pat each other on the back and say, thank you for what you've done to contribute. There was an article on TV last night. They talked about Dolly Parton, and she donated money to help develop the vaccine. Well, she needs to be proud. She did what she could do, the skills she has in her wheelhouse to help this project. Hers was financial, but she needs to be proud of that, and we need to be proud of what we do. So thank your staff and thank yourself for every day you come to work. My last assignment was at Fort Riley Army Hospital, Urban Army Community Hospital, and we had a training program for military medical lab techs. And I used to say to them, when you walk out at the end of the day, no matter how bad your day was, that you should look yourself and look at the mirror when you're going out the door and say, I saved someone's life today. You and your staff can say that you've saved someone's life through your research, through the industrial processes, the lab work you're doing. You've saved someone's life. It may not be due to COVID, but to some other disease, and be proud of that. And finally, we need to maintain a situational awareness. We need to look at people and try and head off crises before they happen. So you usually can tell if someone is suffering either physical or emotional distress, and you need to have that open chain of communication, or that freedom and trust that they can come to you when they need help, or they can just say, Joe, I need to go and take a walk for a half an hour. I have to get away for a minute because it's something bothering me. And the trust that they can share that information with you, and you're going to use it for their benefit and not to harm them. Consider adopting or developing new technologies. Now, when I said the best of times, if there's a silver lining to this, it is that we've proven our ability as professionals to develop or adapt new technologies. We've been able to see the value of the laboratory to basic science of SARS-CoV-2, diagnosis and treatment of COVID-19. And if you read all the journals, all the other myriad discoveries and advancements we've made in all areas of basic and applied science. So the one stellar point at this, or the one shining point here, is that we've been able to really attack and combat this pandemic wholeheartedly and made some tremendous advances in a short period of time. We see massive technological innovations in molecular diagnostics and in therapeutics. I mean, we're doing testing faster, accurately, being able to project it to the field, logistical aspects. It shows our agility and responsiveness to both new innovations in our own areas and also adapting from other technological areas. So we're able to cross-level, if you will, the technology and apply it to our specific work. Now, the big thing, especially here in New York, is more testing. Everywhere you read, there's more testing. And I sort of smile when they say, well, the number of positives is up because we're doing more testing. Well, it seems almost intuitive to me that it's not as shocking as we would. But testing drives the intensity and pace of preventive measures. So up in upstate Western New York, where I live, we're waiting for the governor to come out today and talk about shifting us from some of the areas from yellow zone to orange, which is more restrictive, and then possibly to a red zone, which is very restrictive. Well, this testing also impacts the emotional, physical, and economic health. And we have to be aware that the quality we put into developing a test, which is both sensitive and specific, is important to the health of the people be using that test, either the laboratory people, the clinical people using it, or the patients themselves. We need to remain vigilant. I've said this before, and I have to keep pounding it, is maintain our focus on GLPs, or quality assurance and quality control. And if you look at that cartoon there, one of the doctors actually had sent this to me. He says, that's how the clinicians decide what regulations, heads versus tails. So when I do a CAP inspection at a hospital, I'm part of the team, I usually begin the in-brief with this and say, we don't have that option. We have to do what we know is right and do the right thing for the right reason. We can't fall victim to what I call or refer to as the trilogy of management, or the challenge-facing management. And if you look at the center, I refer to good, fast, or cheap. And the trilogy of management, this theory says the best you can hope for is two of them. It can be good and cheap, but it won't be fast. It can be good and fast, but it won't be cheap. Or it can be fast and cheap, but it certainly won't be good. So this theory, or this maxim, says that the best you can hope for is two of these. Well, which two are your biggest priorities? When you come into work or go to the bench or the office, which two are you focusing on? Do you want it to be good, fast, cheap? Which two is your intent on? And part of the challenge facing us as laboratory leaders is the external forces which we have to deal with. Our leadership, corporate or academic or clinical leadership, may have a very, very different perspective on this than we do. One of the advantages of my pursuing this doctorate in healthcare administration is I've seen from the dark side, if you will, the different focuses, or how the logisticians feel, how the finance people feel, the clinical people feel, the administrators, and their perspectives and their priorities may be different than ours, but we cannot, we repeat, we cannot lower our standards or lower what we regard as acceptable and necessary in order to accommodate others. Optimizing our other areas. It's the counter-tunnel vision, if you will. So in your lab, you have a number of projects going on. Some may be related to COVID, some may not. But you need to maintain that strategic focus on all of your operations. You need to make sure that even despite limited resource limitations or constraints, that we appropriately prioritize and fund and support the areas that we need to do. Continue to support and advance basic and applied research. Continue to support our manufacturing capabilities and the quality management, the overarching quality management that sees across all of these areas. We cannot remain solely devoted to one area, which might be resolving the COVID crisis or addressing the COVID crisis. We need to remember and advocate for all of our other areas because they are as necessary, even though they don't have the headline space or the TV space at night. We also need to remember that economic realities are continuing. I mean, there's going to be focused funding, which is a management way of saying you're not going to get the money you want or necessarily you need. And they're going to focus what they have on COVID as the largest area right now. But we need to consider new opportunities for our staff, possibly retraining them, moving them into a different career field, the impacts on funding, supply, and equipment. Now, I know in the clinical arena, when we look at different test systems, different equipment that they provide, we're also always looking to say, well, it does COVID-19 testing, but what else can it do? Because when we conquer this pandemic, and we will be the next challenge, and how utilitarian is what we're spending large amounts of money on for future opportunities to perform testing or perform clinical operations. So the holiday season. So you think Santa feels the pressure of visiting 1.9 billion homes on Christmas? Try doing it with a mask on. We have Thanksgiving next week. My family, I'm here in Western New York, and I have an extended family here, brother-in-law and sister-in-law, and I have two brothers and their families and my kids down in the New York City area. And we're going to end up, because my in-laws live with us and they're somewhat medically fragile, we're doing everything by Zoom. We're going to Zoom. We're actually playing Zoom Family Feud, which we play every Thanksgiving. We're going to play Zoom Family Feud on Thanksgiving Day. Wear masks. We have to accommodate the change we have. So I know that masks are a pain, but I think those of us at least in the lab field, we're a lot more used to it. So it doesn't bother me as much as the people who've never had that experience or required to use them. So look at some of the added pressures we are under. We have people who are going to be off, but they may be sick or quarantined, and our workload is just piling up. And the more people who are off, the more is cast on the shoulders of those who remain. We have persistent equipment and reagent shortages. I mean, I know my sister-in-law is a pharmacist, and she said that her suppliers have already said that while they'll be prioritizing shipping vaccine, cold chain management for that, they may be delaying other shipments because they just don't have the capability. So they're saying pre-order as much as you can, especially the consumables. People have guilt at taking time off, which you really shouldn't. You need to worry about yourself as well. And there's an overarching, depression, seasonal affective disorder. We have uncertainty and fear. And in the family, you may feel pressure from family and friends to either visit or be visited by them. But travel restrictions prevent it. Financial pressures, those of us who are blessed to have positions, we may have family or friends who have been laid off or have extended unemployment. Using virtual holiday celebrations. I know some folks are very like, oh, that's not the same thing. And we worry about the health and welfare of family. My two brothers are older than I am, so I'm always worried about how they're doing. My son lives in New York City, so I worry about his health and the rest of the family. And again, that depression, seasonal affective disorder, uncertainty, and fear. So it's exacerbated by this. But remember, always take care of yourself first. You must focus and make sure that you are healthy in order to deal with the stress and the challenges we face, both at the holiday time and as a result of this pandemic. So we want to enjoy the time, but we can't have unreasonable expectations. We have to be reasonable and resolute in what we do. It's okay to say no. It's okay to put something on the back burner. It's okay to say, well, we'll get together when this clears, because we must prioritize what truly matters to us, and around those priorities, plan our work and life activities, and thrive through this holiday season, not merely survive. We want to arrive into the month of January feeling better than we did going in from the month of November. So in conclusion, one of my favorite shows, which I have not get to see on Broadway yet, not yet seen it, but the show must go on. We are necessary parts of the challenge we're facing, both in basic and applied research and in the clinical field. So millions of people depend on what we do, and we can't allow this pandemic, we can't allow the external pressures that we're faced on to divert us from what we do. What we do is valued, what we do is timely and appropriate, and we need to, as I said before, celebrate our successes, but not become paralyzed by that fear, despair, and just the uncertainty we're facing, because this show must go on. So this is my contact information. I welcome anyone if you have email questions after we do questions now, but I welcome any comments afterwards. And thank you all and wish you a very healthy, safe, and happy holiday season.
Joe, thank you for that wonderful presentation on laboratory directors, find a balance in the pandemic. So we have time for 2 to 3 questions. So Joe, the first question that I received was, what are some of your strategies for breaking down the silos? And we would love to hear more about this.
So I always try and focus, that's a great question, and it applies in all aspects of our life. I try and pick 1 or 2 commonalities. So what do we share? And then to advance that, to break it down. So I'll use the example of nursing and the lab in the hospital. I start with our staff. We refer to patients as our patients when we just communicate with other clinicians, because we want them to know that the common basis we have is a caring concern for a process or a person or a target. So it's our patients, and you don't want it to be us versus them. So what do we share? Well, we share a passion for the work we do. We share a passion for the patients we serve, or the process or organization we serve. And we support each other. We recognize that, synergistically, we work better together than apart. So that's how I start breaking it down, by saying, I need you. I love movies. Remember Jerry Maguire, help me help you. Many times when I'm in a difficult situation with someone who's very, very rigid in their silo, I start out by help me help you, letting them know that I want to make that first step. I want to turn my chair around and have an outward mindset and say, what can I do to help you? And it's surprising how quickly they recognize that. And then they say, no, let me help you. But great question.
All right, thanks, Joe. So the next question is, one thing that I'm up against is moving at such a fast rate, and then keeping up with GLP regulations can be challenging. Can you give some advice on how to kind of balance the fast pace in the lab versus the GLP regulations and compliance?
Well, again, standards are there for a reason. We have to understand, why they are. And I'm not going to say prioritize even within them, but there are administrative standards and there are quality standards. So when I'm a cap inspector, if I go in and for example, I see a specimen was not labeled. Now that is a citable offense. Not a specimen, I'm sorry, a reagent was not appropriately labeled, didn't have the open and expired date on it. I will look at that and tell the lab that I've identified this, and then I look at maybe 100 or 150 more vials. And if I find all of the others were, then I look at it and say, well, this isn't a systemic, this isn't a cultural event, this is an outlier. So I think when we look at the regulations and the fast pace, we have to say what impacts the process and the patient and what is simply administrative. I mean, if it's the policy wasn't signed off by everyone in the chain, but the clinical director or the technical supervisor did, we have to prioritize that. And I know that's not the acceptable answer normally, but again, we have to deal with the things we have.
Okay, great. Yeah. Well, so one last question is, and so I really liked your your work and family slide, and that's, I guess, how do you handle the balance of work and family as a manager or a lab director? And I know we think about ourselves. I know you talked about taking care of ourselves, but we do have the lab, staff that we have to look out for, and that work and life balance in COVID-19 pandemic is tough.
That is a great question, and it applies even after the pandemic. When I was
Right.
my most recent position, people would come to me and they'd say, I have something going on in my life, and you almost have to, they have to have trust in you that you will be concerned about them honestly and sincerely, and tell you remains, with you. You're not going to divulge it. So when you have that trust and that connection with your staff, and they come to you and say they need something, then you need to, wherever possible, accommodate them, and then reshift other staff or other priorities to allow them to, take some time off. I mean, people come and say, it's my kid's graduation and I'm scheduled to work and no one wants to change with me. No problem. I'll come in and help you. So I had we had a job in the Army called the Administrative Officer of the Day, and I was a colonel. And it's usually run by a sergeant. The sergeant said, my friend's going away to Iraq, and I really want to be off, but I have to be AOD on New Year's Day. I said, no problem, I'll do it. And I showed up. They're like, people don't do that. Colonels don't perform AOD. I said, well, this sergeant had to be off, so you got to do what you got to do. And I knew that I helped them, and they helped me. So they helped me help you. You go that extra yard or the extra mile, I should say, and do that. And then be free to tell your staff, I need a day off and I want someone to cover my my pager. So I deployed to Kosovo for 18 months, and my staff shared my duties so that they wouldn't hire someone to replace me, and I had to tell them to leave when they came back. They shared my duties for no extra compensation because we were a team, we were a family. Hope that addresses that question.
Yeah, that's great, Joe. That's great, and thanks again for answering those questions. So this brings us to the end of our 6th webinar in the 2020 ALMA webinar series. We'd like to remind you that this webinar will be available on the ALMA website. On behalf of ALMA, we would like to thank Joe Keary for presenting today. We'd also like to thank the audience for taking time out of your busy schedules to join us today. Thanks again to American Elements and Spec Certa Prep for sponsoring this webinar. For more information on our upcoming webinars, please visit the ALMA website. We look forward to you joining our next webinar on December 2nd when members from Vigilant present on Back to Business as Usual, how labs are changing and adapting operations post-crisis. Thank you and enjoy the rest of your day.